Welcome, everyone, to another episode of Health Made Simple Show. I'm your host, Dr. Bart, and today we're going to do a two-part. We're going to do clinical insights, two parts. And if you're first time or if you haven't been with us before when we've done clinical insights, I love these opportunities. These are opportunities where I share clinical insights where I think these could be valuable for you or for anybody listening here today, the things we may just come across. And so these, as many of you know, I'm still in practice. So the best I can, I try to bring these real life situations to the forefront so we can relate a little bit better. And I love educating, of course, but sometimes there's so much value in unwrapping a real case. And that's what I'm going to do today. So welcome, everyone, to another episode of Health Made Simple Show. I am the host, Dr. Bart. And of course, I want to thank you all for doing your thing. Keep sharing it out, keep spreading love. It's working. Somehow we're reaching more people. And that's the whole idea, that we can continue just to reach people, to help you, your friends, your family, everyone, just to continue to level up their health. I will continue to say this every time you hear me speak, is that health is simple. That the truth is that the power that made the body heals the body, and we are designed to be healthy. In fact, we were made in the eyes of perfection. Our job is to get out of the way. And sometimes learning some little, tips and strategies and methods and habits that we can implore into our lives is just a nice way to keep leveling up. So keep doing your thing. I'm glad you're here today. Today's clinical insight, two I'm going to share with you today. One is about babies. So if you're having a baby, you know anyone's had a baby, you got an infant, any kid, I take that back. This isn't just for babies. This is for anybody that has fevers. But this is what we're going to specifically target. So the second one is going to be about weighted vests. So make sure you pay attention to that one, because that's kind of an ongoing, growing thing right now. All right. So clinical insight number one, young female. She has an infant. I don't even think he is a year old yet. I'm going to leave out some names here intentionally. So we got about a 1-year-old baby. And of course, babies have what, folks? They're going to have fevers. And it's okay. Listen, I'll be the first one to tell you, I never want to see anybody I love or care for ever in pain, ever, 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 ever. But without pain, we cannot have growth. And we know that philosophically in so many ways. So if you don't feel fully, if you don't have pain, you can't have love, all the above. And this is a little bit different, of course, but the fever may be one of the most important, valuable, brilliant, and beautiful processes of the human body that's ever existed. The fever is what protects us. So I want to walk through this a little bit, and then I'm going to give you some solutions. So let me give you a little backdrop here. So young woman, first baby, about a year old, and we've had these conversations multiple times. She's been under care while she's been pregnant. She's been under care prior to that. So all phases of her life, she has been listening to me in terms of the full philosophical approach toward health. Power that made the body heals the body. Let's just get out of the way so the body has a chance to do it. So she's been inquiring more and more about the baby. And a while ago, I said, listen, at one point, your baby's going to get a fever. It's probably going to have a half dozen pretty intense fevers along the way. Let's be prepared for them. You know they're coming. Be prepared prior to that so you can support your baby in going through this journey, this health journey, so it can develop and build its own immune system. She took heed to it and literally purchased and had the tools, and I'm going to talk about those tools in a minute, very specific, very healthy supplements that we can use as long as we have them. That's the key here. If you don't have them, you can't use them. And the same application and the same tools that we're going to use for an infant, the same tools we're going to use for an adult or anyone in between. So let me go back to the fever process, because I think it's so important that we hear this in different contexts. The first time I heard this about the beauty of a fever, I squinted, I raised an eyebrow and said, what do you mean the beauty of a fever? Like, how is that helpful? Many of you know that the body creates the fever to kill off the bad guys. It's a last-ditch effort. Really what it means is that your body doesn't currently have the antibodies, the part of your white blood cells. It hasn't developed the very specific tools, the weapons it needs to either be killing off the virus, the bacteria, whatever's entered the body. It doesn't necessarily have the tools in abundance in that moment to win that battle. So as a backup system, one of the beauties of our innate intelligence, the one that our creator gave to us, said, listen, I got you covered. When you don't have this all prepared in the moment, we're going to light a fire and we're going to kill the bad guys before they can get you. And we will raise that temperature to the point but always be in self-preservation. So here's the challenge, folks. We've been taught out of a fear model, the fear health model, that if you let a fever go, bad things are going to happen. And right away, people say, well, isn't 104 too high? Isn't 105 too high? What if? And that happens all the time. The moment when I have this conversation with my staff and I'm educating them and saying, there's a time and a place, but the body is doing its best to self-preserve. We really will not see cases where a fever by itself has killed a child. You can Google it right now. Likely you will not find it. And if it is, it's such a rare scenario. It should not be what drives our actions. So with that being said, what temperature is too high? I'm not even going to put a number on it, but I will tell you this. We have seen numbers in 104, 105 all day long for decades. So let's walk through the process of what's taking place in fever. So maybe this sheds light on you or someone else that's going to have a loved one that needs this fever because there's a lot going on. So let me walk you through this. Let's just say you're infant, you got a 1-year-old kid, and that's the scenario that this was. And the kid does not have the antibodies, whatever it's faced with, whether a bacteria, a virus, something comes into the body. Body goes, oh, I don't have the tools to fight you. So what are we going to do? We can't let the bad guys take over. Well, we have a backup system. That's to heat things up and kill them off. While your body is doing that, it's using those tools, the tool to heat up and kill. Simultaneously, your body's identifying with the white blood cells, identifying the bad guys, going, oh, this is who you are. It's sending those white blood cells back to something called your thymus glands, where they're being educated and trained with like killer B cells and killer T cells. And these are the cells, eventually your body develops these antibodies to go kill off those bad guys. And that's when all of a sudden you see the fever do what? Breaks. In a heartbeat, just like that. Boom. It was 104, 105. And then all of a sudden, 30 minutes, it's back down to 100, back to 99, back to 98. Because the body has this brilliant innate intelligence and it knows how to defend itself. Now I want you to imagine for a moment, you're exposed to the bad guy. 103, listen, uncomfortable, crying, achy, sore, burning up. All of these things are taking place. Super uncomfortable, painful for both the mom, the dad, the kid, all the above. And in the middle of it, out of the kindness of your heart, you break it. You don't develop the antibodies, folks. You break the fever. That was part of the process. The fever was telling you how much and how often and what level of defense you have to set up for. And now imagine every time the kid has a fever and it gets super uncomfortable, 102, 103, 104. Oh my goodness, got to call a pediatrician. Oh my goodness, what are we going to do? The baby's going to die. He's going to have a seizure. No, probably not. Most likely it's not. So listen, if the seizure thing does come up every now and then, rare. I never knew a kid in my neighborhood, never knew a kid growing up that had a fever and it turned into a seizure. I do hear it every now and then. I've never seen it clinically, but let's just say that it does exist. We're like, oh, I know somebody. That's cool. You know why those seizures take place? Most likely that child has a sugar diet, more so than it does have good fats. And so that's a different conversation, different time. But nonetheless, we know that children that have good fats in their diets have less likely to have seizures for any reason. So if the what if is the fear, I hate to even say, I'm going to say it this way anyways. Let's just change the what if. What if you interfere 2, 3, 4, 5, 8 times through the course of this child's life, into a toddler's life, and you interfere with this process of making the antibodies? How strong is their body going to be? And we know the answer to that. We know that we're going to have an inefficient immune system. We'll have antibodies that aren't there, and that's the one who's going to unfortunately, probably get sick a lot more often than maybe one of their other siblings who didn't have all the fevers broken. So listen, I know that fevers are uncomfortable. If you've ever had one as an adult, it absolutely sucks. It's painful. Every joint in your body hurts. Your muscles hurts. And again, that's all by design, by beautiful design of the human body, of our creator, creating this mechanism to put in place that when we are under attack, we limit the use of our energy. So it's all focused on that bad guy. So we're not out using our body. And that's why every joint hurts. It's where all the muscles hurt. So you stop using them. And again, this innate wisdom that we have within our body is absolutely brilliant. Now imagine for a second, you take all that pain away and you don't feel the pain. And you needed that energy to go fight off these bad bacteria, these bad viruses, whatever the bugs were. And you're wasting your energy, moving and grooving, all that kind of different stuff. So as we go, being healthy, part of it is being intelligent and also having a relationship with your body and understanding the wisdom that lies within and allowing yourself to express that wisdom. And I will tell you, it is not easy. You have to allow yourself some risk, quite frankly, meaning the risk of I might get super uncomfortable, but I'm willing to do that to get to the other side to see what takes place. And this is like many things in life, frankly. When you're changing your diet, you have to get super uncomfortable, get rid of all the foods that you love to eat, your ice cream, your candy, your cake, your pizza, and all that kind of stuff, and just experience it on the other side. And when you do that, you see how magical the body is, you start thinking that there's miracles taking place every day. In fact, you stop thinking it, you know it. And that's the truth. There are miracles taking place with our health every single day. The only question is whether or not you're allowing it to happen. So let me give you some tools that I recommended for this young mama to have her child at home. Number one is this, to have something called calcium lactate powder. Please do not interpret this as me just saying going down to CVS and picking up calcium. Very specific. Calcium lactate powder. It's a powder form. You put it in the bottle, you put it in the mix, whatever they can get into their body. And then you put it, you'll fair amount through the course of the day. Now, will this make the baby poop a lot? It sure will. It's going to eliminate like a mo, which is fine. We're going to get things out of their body, but it's also going to help protect the comfort of the baby. This is not about getting the temperature down. This is allowing that temperature to rise, but keeping things basically intact, helping the baby process through the pain of the fever by providing enough calcium. That's why the skin turns red. That's why it gets so hot. There's not enough calcium there to help regulate that tissue. The second part of this is this. Make sure that you have something that fully supports the white blood cells, the immune system. We use something called Conjuplex Chewable. Don't care how you get it into the baby. Maybe you smush it up, put it in applesauce, put in a little bit of water, whatever it is, a chewable tablet. But have these tools at home, folks. This is the biggest difference. These things usually seem to happen at the worst times of the day, late at night, in the middle of the night, that kind of stuff. And no one's available. Your doc's not available. The stores aren't open. So prepare yourself. So if you're listening to me now and you got a toddler at home, make sure you go find, and I'll tell you, we'll make sure it's in our notes today or in our show notes. Calcium lactate powder. It'll sit on your cabinet, in your cabinet for years, for that matter. It's just calcium. And then something called Conjuplex. This is good for every time they get a sniffle, a cold, everything. Any kind of sickness, you name it. The Conjuplex Chewables. Conjuplex Chewables are a supportive supplement to help build up the immune system so it has the tools to fight in the moment. A lot of the times, these sicknesses, these fevers are prolonged because the tools aren't there. So this is something you could significantly help your loved one with by just making sure that you have the proper tools. So those are the first two. I'm going to throw two others out here just because we're having this conversation. Two of the things that I would recommend having around. I would have a child's immune support. That's a little bit different. That's an everyday immune support. Like we're going back to school. This is school time now. We're going into fall season. We're going to see a lot of head colds, we're going to see sinus issues. Start supporting it now. They're going to get exposed. You got a kid from 0 to high school or, 0 to say 12th grade. They're going to get exposed to something. They don't necessarily have all the weapons yet, all the antibodies developed. So they're going to get some head colds. They're going to have some sickness, if you want to call it. So have the weapons available. So in those moments, you don't have to make these really tough, brutal decisions like putting them on a steroid or putting them on an antibiotic. And please don't think that those are innocent. They're called drugs because they all have side effects and they're all damaging to the human body. And I understand why people use them. I understand why my mother used them. And mostly because she didn't know anything else. She was doing the absolute best as she could. That's why I grew up on antibiotics, like many of you did. But listen, with knowledge it drives power. Our power to make the next decision a little bit better. So clinical insight number one here, if you want to help kids that have fever, and this is the same protocol for adults. If you have a fever, use calcium lactate powder. For adults, it'd probably be 2 teaspoons a day. And listen, yes, you're going to poop a lot. It's going to move things right through your body. And for a child, maybe 2 teaspoons a day. If they're really an infant, like the one we're just talking about, a teaspoon probably through the day would probably do the trick. You might need a little bit more. With that being said, the Conjuplex Chewables, you can chew on them all day long. I have no problem with them taking 10, 15 per day. They're nutrients, folks. They are whole food nutrients. They will support the immune system. And then some people will say, well, oh my goodness, that's so much. So much what? Nutrients? Stop thinking of it as nutrients or supplements as pills. Yes, if that was 10 or 12 Tylenol, absolutely never do that. That would be dangerous. Putting 10 or 12 whole food supplements into a child's body while it needs more tools, it's a good thing, not necessarily a bad thing. All right, so that's number one. That's a nice little clinical insight about children. Here's the next one I want to give you. This one isn't necessarily about a patient, but a topic that keeps coming up and I get asked a lot about, and that's these weighted vests. You might see some people walking up and down the streets. We see a lot of it. Now I'm seeing Instagram posts and some of even my colleagues, some of my friends and colleagues out there, my chiropractors and physical therapists, who I love and respect, but I see a lot of them talking about not using them and don't do this and don't do that because it creates disc issues. Well, I'm on the other side of that fence. So if you're not familiar, you might see someone walking down the street right now and it looks like they have like a vest on, and they do, and they're weighted vests. They might be 8 pounds, 12 pounds. I got some people walking around with 40-pound vests on. So let me give my little disclaimer here and say this. This is very, very important to understand. A weighted vest is a piece of gym equipment, okay? It is a tool that we need to learn how to use. Used improperly, it probably can create some problems. Used properly, and it gives us an opportunity to take a very simple thing, a very great thing like walking, and maximize the benefits in a short period of time. So you can double down. So I really do like the idea of weighted vests. Now, with that being said, one, you do not need to maximize weight. If you just carried 10 more pounds on your body, no matter what your size, that would be significant. Let's just say you're under 150 pounds, and I would say maximum, you're probably 10, maybe 12%. So, there's a general number out there about 10% of your body weight. I wouldn't even go that much. For some people, if if you're 200 pounds, 20 pounds would be a weighted vest. Maybe you can carry that. But listen, just like in the gym, you start off light. You start off light with weight, and you start off light with duration. So maybe a 10-minute walk a couple times a week with it. The important part is yet to come here, folks. So you start light. Remember, this is a piece of equipment. Here's where people run into problems. So as a chiropractor, I can't help it. It's born within me. Every single day when I see people walking, I see posture. I see mechanics. I see spines moving. I see gaits moving. I see people flow or not flow. I see shoulders that are stuck when they're walking down the road. It's just, unfortunately, that's how I see the human body walking down the street now. So that being said, when I watch most people run and walk, they're very, very poor mechanics solely because of where they're looking. They're looking usually 6 to 8 feet down in front of them. That means they're going to have a forward head tilt, a forward head carriage, and that is stressful to the human spine. That's stretching the spinal cord. And that is not what we want, folks. That loaded up with extra weight is a problem. So for the men and women out there that are touting as they're creating more disc issues with these weighted vests, I can understand if people are loading up with poor posture, just like squatting in the gym, just like carrying weights in the gym, you could use these tools ineffectively and create some damage. Yet, this isn't rocket science. Stand up straight, look about 100 feet to 100 yards out. Nice tall posture. There are different vests that allow you to put the weight in different areas of the body. If you could put it on back and front, beautiful. If you could just backload it, it'll probably keep you upright even better. For the people that I know use it that way, that are able to backload their weights, does better. If they have them in the front and the weights are a little bit heavy and you're not used to it, or your core is not strong enough, the obvious is that it's going to pull you forward. And the more it pulls you forward, now we are compensating even more between the muscles on the front, the anterior, and the posterior. We're making the ones on the back tighter, which they're already too tight because we have all these sitting postures and these forward head carriages, and they're making ones on the front all what we call they're shortening down, they're creeping short. So if you're going to use a weighted vest, I think it's phenomenal, and I think it would also give you good perspective. What happens when you simply put 10 pounds on your body, 20 pounds on your body, carry a vest around for a little bit, and you'll know real fast why there is such a thing as an ideal weight for your body. But using a weighted vest for short walks, maybe start off at a 10-minute walk, maybe work up to a 20, 30-minute walk over time. I think it's phenomenal. I think it's a great way to double down on walking. I think walking is a phenomenal exercise. You've heard me talk about it before. I think walking after dinner is one of the most effective ways to make sure we manage blood sugar, to manage things like our overall weight, and to manage things like insulin resistance. You throw a weighted vest on there and you are doubling down on a simple walk that you're already doing. And now you're maximizing what you can get out of that walk. So when it comes to the weighted vest, I am a fan, but just like any other piece of equipment that we have in the gym, knowing how to use it, how long to use it, and when to use it is also very important. All right, folks, that's it for today. Those are some clinical insights. Hopefully I find you in a good place. Hopefully you continue to do your thing in terms of leveling up your own health. Make sure that we're always taking deliberate action for your mind, your body, overall wellness. You gotta be awesome.